Indiana in the Morning, presented by First Commonwealth Bank. Time to be first, member FDIC. It is 8:12 on this Tuesday edition of Indiana in the Morning. And our interview at this time presented by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. And joining me now in studio from Indiana Regional Medical Center, we have neurologist Dr. Ehud Zeltzer, and I hope I got it right this time. I hope
Good job,
I did.
yeah.
All right. Dr. Zeltzer, thank you very much for coming over here today.
Thank you for having me.
So, a what got you interested in that field? Just wondering.
So neurologists deal with the nervous system, and I think most interestingly the brain, and we look how the brain functions, how different regions of the brain affect behavior, thinking, movement, and how conditions that affect the brain affect patients.
So you just had a great interest in that from the very start?
Oh, from the very start, yeah.
Oh, wow. Excellent. How long have you been at IRMC now?
So I was excited to join the Indiana community almost a year ago. I came here after a 3-year fellowship at the University of California in San Francisco. It's a very nice place with very nice people, and I'm very happy to be here.
Excellent. Well, one of the things we've been talking about a lot this month, stroke awareness, because I believe it is Stroke Awareness Month. Maybe for the people out there who, I think they kind of get confused on what a stroke is and what a stroke isn't. Maybe you can tell us, what is a stroke?
Yeah, so that's a great point, and I think these are one of the diseases or conditions that where public awareness can really make a difference. So really, thank you for spending the time talking about it. A stroke is a neurological condition when there is very sudden onset of brain problems. So within seconds or up to a minute, a patient develops difficulty talking or weakness or difficulty walking. And this happens, there are two types of strokes. One is caused by brain bleeding. I'm starting with that, although this is the more rare type. And I'm not talking about the bleeding that's related to a head injury. I'm talking about a spontaneous bleeding because of a damage to a blood vessel.
Okay, so we're not talking about something from a concussion or anything like that.
Exactly, yeah.
Okay, and so that's one type, and you said that's kind of rare?
So that's the less common type. It accounts for about 20% of the cases of stroke.
Okay.
And the more common type, and I think we should focus on the other type, is caused by clogging or blocking of an artery that supplies blood to the brain. And then we have a brain region that doesn't receive blood. And this brain region, because it's not receiving blood, stops functioning or starts functioning abnormally.
Okay, so the acronym BEAST has been used a lot in identifying a stroke. What does that stand for, and how can it be used?
Right, so the acronym is Be Fast.
Be Fast, I'm sorry. I read that wrong. My eyes were crossed. So Be Fast. So what is BEFAST? What does that stand for?
Yeah, so I think this acronym is important because, people are used to, if someone has chest pain or shortness of breath, it's pretty intuitive that you need to go to a doctor or to call 911. But the symptoms of stroke are kind of less intuitive, and that's why we use this acronym, Be Fast. So B stands for balance. So patients have difficulty walking or an unsteady gait. E stands for eyes. So patients with stroke can have difficulty with vision, usually loss of vision on one side, either on the right side or the left side of the visual field. Okay.
And now up to F.
Right. So F stands for face. So there's asymmetry of the face, usually drooping on one side of the mouth. And then A stands for arm. So there's usually weakness or numbness in the arm with drooping of the arm or dropping items held by the arm. Then S stands for speech. So there can be slurring of speech or inability to talk, or saying wrong words that don't exist, or complete inability to talk. And then T stands for time, which alludes to the whole acronym. So Be Fast, because now when such things happen, and happen suddenly, then it's time to call 911.
The sooner that you can get somebody in there, the sooner that it can be treated, and the sooner that the negative effects can be impacted, and you won't have anything multiplying on top of that, it sounds like.
Exactly. So we say that time is brain. So the minute the stroke starts or an artery supplying blood to the brain is clogged, the clog starts ticking. And the earlier we intervene, the earlier we open this occlusion, the better the outcome of the patient will be.
You mentioned two types of stroke. We're going to stick to that more common one where there is a blockage. What are some of the major risk factors that can lead to a blood vessel being blocked to the brain and a stroke ultimately happening?
Right. So, these are usually, the standard risk factors involved and that can be mitigated with more healthy lifestyle. So, of course, smoking. This is the first thing that, the thing that is, I won't say easiest, but the most obvious thing that someone needs to stop doing to prevent a stroke. Then high blood pressure, diabetes, high cholesterol, overweight and poor diet, lack of physical activity, the same things cause heart attacks and many other conditions.
I was about to say, those sound like a lot of common conditions that many people in our country have every day. I mean, everything from high blood pressure, high stress, obesity, and diabetes. So it sounds like a lot of common factors can lead to it. And you said that mitigation obviously just means getting healthier in many of those cases.
Absolutely. So stopping smoking, eating a healthy diet to lose weight for persons who are overweight, and working usually with a PCP to control high blood pressure, high cholesterol, and high diabetes or high blood glucose. These are the things that can really make a difference and prevent stroke. And of course, if someone already had a stroke, then what we call secondary prevention, then we do other things to prevent another stroke.
Okay, so there would be things that you could do to prevent a second stroke, and obviously a second stroke multiplying on top of what happens after that first stroke has happened. So what does recovery look like after a stroke has been suffered and somebody's brought through it successfully?
Right. So, the severity of stroke can really vary a lot. Some strokes are very mild, because, for example, mild arm weakness, strokes naturally, usually improve over time spontaneously. But then, when in more severe cases, patients usually require some form of rehabilitation to gain functions that they have lost. And fortunately, we know that the brain is able to recover and sort of relearn to do some of the things that it has lost during the stroke.
I think I remember hearing about one very famous stroke case of Dick Clark, who was a famous television host, and he lost the ability to speak, but still was trying to work on it and continue to rehabilitate himself over time to the fact that he could get back on the air, albeit in a limited capacity, but he was still able to get back on the air for a few years. And even though his speech was slurred at some times and his voice wasn't as powerful as it was, I guess that kind of shows just kind of the impact that a stroke can have on a person. Let's talk about this event coming up on June 12th. This is called Minding Your Brain Health Chain of Survival. You were talking about time is brain, that's part of it, but what else can people see as part of this program that's coming up on the 12th at 6 o'clock?
Yeah, so you're welcome to come to IRMC cafeteria to learn more about stroke. Maybe I can give you a brief overview of what we do with a patient.
Sure,
that
go ahead.
comes quickly as soon as possible to our emergency room as soon as stroke symptoms started. So because as I said, time is brain, we try to do a very brief, focused evaluation of a patient. It's usually done first by one of the ER providers, and a neurologist is called when needed. And then we very quickly do a brain imaging, usually a CT or a CAT scan.
Mm-hmm. So this happens within minutes.
Absolutely, within minutes of coming to the emergency room.
And with that acronym that you mentioned, Be Fast, I imagine the emergency room workers would be able to spot that very quickly whenever the patient comes in. Even the EMTs might be able to spot it.
Exactly. So paramedics know how to identify those symptoms and actually alert the emergency room that they're on their way.
This is fascinating stuff. I mean, you think about it. Just one little thing one little normal thing can set off something like a stroke in our head. It could have a major impact. It could I say have a major impact, as you said. There are different severities of stroke, but it's amazing what can be done. So whenever the operation is required, I guess you're just kind of clearing out the blockage then in the brain?
Right. So usually there's no operation involved.
Okay.
What we do is we give a medication that dissolves blood clots.
Okay.
Right. And this should be given very quickly so that there is still brain tissue that can be salvaged, that can be helped.
All right.
And then in other cases, we do intravascular intervention when a catheter is placed inside the artery to try to physically remove the occluding thrombus.
This is amazing stuff here. I mean, I'm getting a lot of education. I know a lot of people will get the education at the Minding Your Brain Health Chain of Survival event. This will be at the IRMC cafeteria, 6 p.m. on June 12th. Anybody can come?
Yeah, absolutely. You're all welcome.
And a lot of experts are going to be there for that. And if anybody has any questions about their neurological health, how can they get a hold of you?
Oh,
Call the hospital, I'm assuming?
just call the hospital. We'll be happy to see you and help you.
Well, Dr. Ehud Zeltzer, thank you very much for being on Indiana in the Morning. This has been an amazing discussion. I think I've learned a lot more about stroke than I ever thought I knew, because it just is amazing how different it is. I mean, we have the kind of preconceived notion that, stroke might look like a heart attack or something like that, because we see it on TV, but it actually looks very different, and the effects are very different. So it is important to get that information out there. Doctor, thank you very much again for joining us, and please come back anytime.
Thank you so much.
That was Dr. Ehud Zeltzer, neurologist at IRMC, for joining us on Indiana in the Morning. Our interview presented by Marcus & Mack, voted best law firm, best personal injury lawyer 3 years in a row, best of Indiana County contest. Visit them online, marcusandmack.com. It is 8:24 on Indiana in the Morning, and we're switching from physical health to mental health in our next segment. We'll be talking with Dr. Ralph May about mental health for kids, and that's coming up in our next half hour here on Indiana in the Morning. Of course, with the summer months coming on, we want to make sure that kids are well taken care of, especially on the mental health issue. So